I really want to get to know my patients. I want to know what's important to them, what their goals, what their aspirations are, because we talk a lot about their illness and we talk about their labs and their needs, but really what's most important to me is what happens outside of the hospital doors. So I want them to do the things in life that bring them joy, that bring them meaning, and that's a big part of what I do. Hi, I'm Dr. Alex Kula, and I'm a pediatric nephrologist at Lurie Children's. So nephrology entails everything related to the kidney, and that includes blood pressure, which is controlled by the kidney. Some patients are very healthy and only have minor issues or minor kidney issues, where some kids have full-on kidney failure and they require dialysis, they need a kidney transplant. And so you see a wide range of severity, and we care for it all. We have a large transplant program here at Lurie with excellent outcomes, so patients from far around often come here to receive kidney transplants, and we provide comprehensive care for transplant patients, both before and after. Research is actually a big part of my job here at Lurie Children's, so I'm really interested in the interaction between heart and kidney disease. There's this kind of universal truth that most patients with kidney disease will go on to develop cardiac complications, and most patients with cardiac disease and heart disease will go on to develop kidney complications. And then once both organs are involved, outcomes are much worse and care for those patients becomes even more complicated. So I want to understand why the kidney and heart seem to be so closely linked, and more importantly, what we can do to improve outcomes for patients who have both kidney and heart disease. I think to be a good nephrologist, you have to be curious because the problems are always very complex, involve a lot of different organ systems, and often it requires a lot of thinking and piecing things together. So everyone I work with is curious. Everyone I worked with is committed to getting the right answer, not just necessarily their answer. And so you find people who are humble and committed to finding the truth. I think one great thing for families is they'll have all their needs met when they're here at Lurie Children's. So they're able to see all the specialists who will provide them care no matter how complex their issue. They'll be able to have help from the support staff, social worker, dietitians, nurses, people that will provide education and support as they go through dealing with a major illness. And as a provider with patients that often have complex care needs, it makes my job much more enjoyable.